Hello, and welcome to this brief talk on the Medicare inpatient-only procedure list. To align with CMS guidelines for inpatient-only procedures and to ensure appropriate reimbursement, Epic will now display alerts or Our Practice Advisories, or OPAs, to remind you to select the correct patient class and place an inpatient admission order. An inpatient admission order is required for all inpatient-only procedures, even if the patient is discharged directly from the post-procedure recovery area without being formally hospitalized. Omitting this order can result in both financial penalties and compliance risks. The OPA was created by a multidisciplinary team that included practicing surgeons from across the network, as well as experts in utilization management. It will go live on May 21st, 2025. A little history on the inpatient-only procedure list. It was introduced by CMS over a quarter century ago as part of the outpatient prospective payment system. The primary goal was to safeguard patients by ensuring that complex and high-risk procedures were performed in an inpatient setting where comprehensive postoperative care and monitoring could be provided. It also aligned with Medicare's reimbursement strategies, focusing on the appropriateness of the setting for service delivery. An updated list goes into effect every January 1st. This is what the inpatient-only procedure list looks like. In column D, there are so-called C codes, which indicate a procedure that can only be done in an inpatient setting. In most cases, you won't need to see the list directly yourself. It's built into the logic of Epic and should recognize your procedures that are coded on the list. However, there will be links available in admission order sets. It's also available on the CMS website at cms.gov or at ronaldhirsch.com. The requirements to be paid by CMS for these procedures is that an inpatient order is placed prior to the patient leaving the facility. The necessity for the procedure itself must be well documented in the patient's medical records, and this documentation is critical not only for CMS reimbursement, but also for audits and compliance checks. Importantly, there's no minimum stay required, so the patient can be discharged home from the PACU after the procedure ends. Some pitfalls would be if an inpatient order is not entered prior to discharging the patient, or if an unexpected event occurs during surgery that changes the procedure from an outpatient one that's planned to one that's inpatient only. The surgeon must be diligent in recognizing this and entering the inpatient order. The consequence of not entering the inpatient order is that the procedure results in zero payment to the facility. So what could go wrong? If inadvertent scheduling of a non-IPO procedure occurs when an IPO procedure is planned, or if unexpected events change a non-IPO procedure to an IPO procedure, an example would be a ventral hernia that's larger than expected. You're not expected to know all of the size limits for inpatient only or outpatient hernias. However, you should have a general understanding that in many cases, size does matter. Also, if the surgeon ignores the OPA warning, this can result in loss of revenue. This is what the OPA looks like. There's an opportunity for the surgeon to enter the inpatient order directly from the OPA. This will appear in the pre- and post-procedure navigators in Epic if the procedure is on the IPO procedure list, and there's no active admission order, and the patient has Medicare or an other IPO qualifying insurance. Your office staff and schedulers will also receive a version of the OPA. It's important for them to understand that it's not something just to click away, but should prompt them to ask their provider to enter an inpatient order. You should advise your staff to request an inpatient order when the OPA comes up. Notably, if inpatient orders are signed and held, the OPA will continue to fire until the admission orders are released in Epic. How do we prevent loss? It's important to educate your staff and be aware yourselves about the IPO list procedures. Pay attention to Epic OPA warnings for IPO list procedures. Anytime that a case ends with a different procedure than originally planned, you should reconsider the CPT code. This needs to be updated in the procedures section of Epic, which can be done by the circulator. Updating your operative note alone is not enough to solve the problem. On rare cases that do slip through without an inpatient admission order, you should collaborate with the network physician advisor on call in entering an addendum to your notes as necessary. You can use the Spoke feature in Epic to reach the network physician advisor, who's available 7 days a week from 8 a.m. to 5 p.m. Again, if any questions come up about how to use the list, please feel free to reach out to the network physician advisor on call. Thank you.